people, talking excessively, and history of suicidal attempts for tourists on admission. But on interview, presents restlessness, irritability, poor concentration, and talking to self and depressed mood. History of present illness. The patient was apparently well until 2 weeks prior to admission, when she started showing abnormal behavior. She became confused, aggressive, and violent toward other people. She was talking excessively, sleeping poorly, and sometimes wandering around without proper direction. Relatives also reported that the patient became irritable and easily injured. 5 years ago, the patient experienced a similar episode, which lasted for about 9 months. During that time, he was mentally disturbed and received treatment at psychiatric clinic, where his condition improved after using medications. The patient also has history of suicidal attempts, where she intentionally stood in front of a moving car, aiming to die, but she survived. Family members reported that the patient sometimes threatens people and physically assaults them during episodes of illness. No history, and the patient have no history of epilepsy, head injury, or substance abuse. On past medical history, no history of hypertension, no history of diabetes mellitus, no history of epilepsy, but she has history of recurrent mental illness, no known drug allergies. Past surgical history, no history of surgery, no previous blood transfusion. Treatment history or medication. The patient was previously admitted to a psychiatric hospital 5 years ago and treated. Past psychiatric history. The patient had a previous psychiatric admission 5 years ago with similar symptoms of confusion, aggression, excessive talking, and insomnia. The episode lasted for 9 months before improvement. Psychoactive substance use history. Occasional alcohol use, no cigarette smoking, no illicit drug abuse. Forensic history, no history of criminal offense, no history of imprisonment. During illness, the patient became aggressive and destructive. Morbid personality. Before illness, the patient was calm, hardworking, social, and responsible in family and business matters. Personal history. The patient was born and raised in Songo region. She completed secondary education and later engaged in business activities. She lived peaceful with his family before onset of illness. Family history. No known family history of psychiatric illness. No family history of epilepsy or substance abuse. Social history. The patient lives with her husband and children. During illness, she isolated herself, becomes aggressive, and has poor interaction with others. Physical assessment. On quick assessment, patient cautious but restless, poor concentration, aggressive behavior noted. Vital sign. Temperature 36.7 centigrade, pulse rate 100 beats per minute, respiratory rate 22 beats per minute, blood pressure 128, diastolic and 128 systolic and 84 diastolic, limit of mercury. Head to toe examination. Head, normal scalp appearance, eyes pupils equal and reactive to light. Ears, no disturb noted. Nose, nasal passage patent. Mouth, oral mucosa moist and pink. Neck, no enlarged lymph nodes. On chest, normal chest expansion with clear breathing sound. Cardiovascular system, normal heart sound. Head, abdomen soft and non-tender. Extremities, no edema or deformities. Skin warm and intact. On mental status evaluation, mental status examination. On general appearance and behavior, the patient looks until appearance, restless and overactive, poor eye contact, easily distracted, aggressive at times. On perception, Occasionally, patient talk to herself. Possible auditory hallucination. Speech was rapid and loud. On motor activity, hyperactive and restless. Thought content, suspicious and grandiose ideas present. On thought content, kitu ambacho tulikuwa tumemwona mgonjwa, on grandiose ideas tuliona kwamba mgonjwa tunamuuliza kwamba wewe unaishi wapi, akasema kwamba anaishi mkoani ambako ni mjini, lakini pia akasema kwamba anasoma UDOM, kwamba ni mwalimu, lakini appearance yake ilikuwa sio hivyo. Yeye anaishi huko kijijini shambani.
Ndio hicho kiandika.
Alafu utasemaje kuwa appearance yake unamwona kwa appearance kuwa hawezi kuishi UDOM, au sijakuelewa?
Yeye mwenyewe alisema kwamba yaani namna alipokuwa anaongea taarifa zake za uhalisia ambazo alikuwa ametoa kwamba yeye anaishi kwamba Matula, lakini pia yeye ni mkulima, analima shamba, lakini anakuja kutuambia huku ni tofauti. Alisema kwamba yeye anasoma UDOM, anasomea ualimu, lakini pia yeye haishi kijijini, anaishi mjini.
Okay, as Chief said kuwa haujaweka evidence, ndio?
Mood irritable and elevated. Affect is labile. Sensorial and cognition. Cautious, intact, oriented to time, place, and person. Poor concentration, memory intact, insight poor, judgment impaired. Psychiatric diagnosis. Bipolar affective disorder, current episode mania with psychotic features. Supportive features, recurrent episode of mental illness, aggressive behavior, excessive talking, insomnia, confusion, restlessness, talking to self, poor judgment. On management, administration of mood stabilizers, example carbamazepine, sodium valproate, and lithium carbonate. Antipsychotic medication, haloperidol, chlorpromazine, sedative for sleep, diazepam and chlorpromazine, psychotherapy, family counseling, continuous psychiatric follow-up. Nursing care plan.
What is your question? Question zako umeweka nini?
Bipolar affective disorder.
Bipolar affective disorder.
And current episode of mania and psychotic features.
Supportive features.
Supportive features, recurrent episode of mental illness, aggressive behavior, excessive talking, insomnia, confusion, restlessness, talking to self, and poor judgment.
Na kwenye treatment unasema
administration of mood stabilizers.
Mood stabilizers. Kama hivi.
Carbamazepine, sodium valproate.
maana yeye sasa amesema administration of mood stabilizer. Example, sisi tunahitaji lili treatment.
Issue iko hapa sasa. Yaani report inaandika ezifu mjamona ni mgonjwa. Sawa. Yaani ndio maana nimesema kwa wale wa kwanza nimesema yaani reporting ya mental. Yaani fanya kama ndio ulikuwa unafanya. Yaani wewe ndio umefanya, sawa? Hata kama hiyo dawa amempa mtu mwingine, wewe ndio umefanya. Tumeelewana? Unaposema unapoweka sijui apewe sijui mood stabilizer. Sawa? Tunajua dawa zipo nyingi hapa, ndio? Wewe sasa kwa nini uweke kategori, uweke group la dawa wakati unajua dawa ni upepo? Maana yake unaandika theory unasoma darasani. Ndio? Unaelewa? Uwezo kuweka group la dawa wakati unajua nini? Dawa. Anyway,